About thrombosis and how do you detect thrombosis, and what tests have been developed over the years to try to detect it. The problem is that when you collect a blood sample, it might contain some markers of thrombosis, but they are diluted in 5 litres of probably near normal blood, so it's very difficult to know much about thrombosis and where it's coming from and what's causing it. There have been attempts made over the years to try to localise where a blood clot might be forming, where a clot may have formed in the circulation. One of the early methods was to use radioactive iodine. Iodine isotopes can be readily attached to proteins, and one of the proteins which becomes attached to a blood clot is plasminogen. It's a normal response that when a clot forms, it accumulates plasminogen. And early researchers could attach radioactive iodine to plasminogen, inject it, and it tended to localize in blood clots. Then they could use a gamma ray camera to identify and localize where that clot was occurring. That wasn't terribly successful. The clinical trials showed it wasn't very useful, but there have been many improvements made to that. One of the ones, one Australian company, the company which developed the dimer test for cross-linked FDPs, tried to use their antibody against cross-linked FDPs to localize where a clot was occurring. And likewise, they used radioactive iodine, attached it to their monoclonal antibody, which then bound to cross-linked fibrin clots. And they spent millions of dollars doing this. It looked like a very impressive breakthrough. But in clinical trials, it wasn't all that useful. The fibrin that the antibody detected appeared at a number of sites in the vasculature, and certainly it lit up the clots when they were there, but it also there were non-specific events, and it turned out not to be particularly useful. So localizing clots still is unproven. More recently, it's been shown that the CAT scans and NMR can actually detect clots themselves without any need for external labeling of any sort. So I think these efforts have gone unrewarded. But I still think there are methods for trying to identify so-called hotspots that may be occurring in blood vessels, and the way to do this, there's another way of doing this using looking at platelets that may be bound and activated within a clot. So there are antibodies against platelet markers of activation, and they have been, another one is, there's a phospholipid binding protein called annexin. Annexin 5 is used in studies to localize exposed phospholipid surfaces. And the same company I mentioned before that was using the antibody against cross-linked fibrin, they also tried annexin 5, which had been labelled with iodine, to localize where active phospholipid may be exposed to the blood in the vasculature, but apparently this wasn't terribly successful either. So localizing clots is still a difficult problem, and tests on circulating blood have proved not to be as useful as idealists like myself thought they might be in the first place. So thank you very much.